All right, this is a great topic. It's one of those ones that on the surface can seem pretty easy, but when you dive into the details, you see the details really matter. So let's talk about diaphragmatic breathing and give you a quiz. I'm going to give you 1 minute to answer these questions and then we'll go over them. If you're ready, feel free to skip ahead and watch me go over the answers. Okay, let's review the first answer. So, can you list 4 patient populations who would benefit from diaphragmatic breathing? Well, you really want to think about what we're gaining from doing diaphragmatic breathing or what is the purpose. And this really is to help open up the airways and increase circulation in the lungs and really try to help get that air down into the bases of the lungs. So, if your patient has pneumonia, atelectasis, post anesthesia after a surgery, or prolonged bed rest, they're great candidates for diaphragmatic breathing. Now, can you list 5 goals of diaphragmatic breathing? And again, these are the reasons why we do it. And these are great multiple choice questions if you're doing your written exam, and wonderful written follow up questions if you're doing the practical. So, we do diaphragmatic breathing to decrease accessory muscle use, to decrease respiration rate, decrease dyspnea, increase tidal ventilation or volume, and ultimately increase oxygenation. And what about 3? How did you do with this one? The correct answer is C, high Fowler's position. Now remember, the diaphragm works optimally when the individual is sitting upright. So this technique may be taught in supine if the patient is quite deconditioned or cannot sit upright, but ultimately the ideal position is in high Fowler's. Here's a little fill in the blanks for you. I'll give you about 20 seconds to answer this one. So when demonstrating the technique, you want to place the hands over your stomach. You want to take a long, slow inspiration through your nose for a count of 4 seconds. As you breathe in, your stomach should rise. And this is a tricky one, so make sure you get this one right. Take a relaxed expiration through your nose. So remember, when performing diaphragmatic breathing, it's all about completing the technique using the correct steps. We use PT Exam Prep's framework to make sure you get your full checklist marks when doing this on your exam. All right, last, the FITT parameters. The FITT parameters are super important here. What you want to do is do this 10 times for every waking hour. Sitting again, if possible, long, slow, 4-second inspiration through the nose, and only perform 3 to 4 breaths in a row to avoid dizziness. Thanks for joining me today.